Hello, my name's Alison Knowles. I'm one of the infection control nurses from Northumbria Healthcare Trust. I'm here with my colleague David.
Hello, I'm Dr. David Tate. I'm the Director of Infection Prevention Control for Northumbria Healthcare Trust, but I'm also the clinical lead for microbiology as well.
Okay. We're taking this opportunity to ask some questions around COVID that may help you or give you some food for thought. So, why is COVID different to flu or cold symptoms? What's different about it?
Okay, so there are some similarities between COVID and flu. One of the similarities is how it's spread. So both flu and COVID or coronavirus are spread via either coughing and inhaling or getting those droplets into your what we call your respiratory tract, so that's going in through your nose, in through your mouth and into your lungs, or coming in contact with your eyes. The other way is what we call touching something that somebody's coughed on. So that in that way, the way what we call the transmission, is how it's spread, is the same. What's different about COVID or coronavirus to flu are a couple of things. Flu typically infects or has a nasty infection in the very young and the very old. We haven't seen that in coronavirus. So COVID-19 hasn't typically caused nasty infections outside of very few in younger people. So that's one difference. And the other difference is that once you catch it, more people get severely ill and unfortunately more people die than we would expect with flu. So those are the sort of two main differences. In flu you get a lot of cold symptoms, you get a lot of runny nose, sore throat, aches and pains. That's different in COVID. For some reason COVID or coronavirus bypasses all of the what we call the upper respiratory tract, goes straight down into the lungs and damages the lungs, which is why we're seeing more people getting severely ill and unfortunately more people dying. So that's a bit more unusual. So typical symptoms of COVID are a barking chronic cough, loss of taste or smell, a high temperature, as opposed to flu where you get a runny nose, eyes, a bit achy, pain, maybe a sore throat. So they are subtly different. In very young children that can be quite difficult to work out the difference, but as you get older it becomes more clear which one is which.
So it can be quite confusing for people, can't it? Because the symptoms can seem similar.
Yes.
And so we're advising anybody who has a high temperature,
Yeah.
a new persistent cough,
Yeah.
and loss of taste or smell, they're the
Yeah.
main symptoms. They might get other symptoms alongside of that,
Yes.
but they're the main symptoms
Yeah.
that most people would get, is
Correct.
that right?
But especially in school-age children, runny noses, runny eyes, a bit of snotty, bit of a sore throat, they're not really associated with COVID or coronavirus, so we're not advising those people to what we call self-isolate or stay off school or go and get a test. So that's where there's a clear distinction. So as you said, any of those three symptoms that you described, we need to think about COVID. The sort of runny nose, sniffles isn't typical of COVID, and most of the evidence is that it doesn't cause that.
Yeah, brilliant. You've talked about the way this is presented, how it's caught people, older population perhaps. Why are we seeing a resurgence now then, especially when the young ones have gone back to school, people are going to university, people are socialising more? Is it about social distancing or?
Yeah, so I think all these, as I said, like with flu and coronavirus, these viruses spread typically by the respiratory tract. So somebody coughs it up and you're in close proximity. So when it's warm and sunny outside, most of us are not indoors. We're more than 2 meters apart. So that's the first way of preventing yourself getting coronavirus, is you stay more than 2 meters apart. The second way is if you can't do that, you're going to need to wear a mask. That mask potentially protects you, although the main effect is to protecting other people if you've got a cough or a cold. And one of the major differences between flu and COVID, why the mask is important, is because we get people with no symptoms who can pass COVID on. That's not common with flu. So another reason for wearing the mask, socially distancing. And the third way is washing your hands, so that if you've touched something that potentially had coronavirus on it, it can't penetrate through your skin, but what it can do is if you touch your nose, your mouth or your eyes, it can get in through that way. So that's what you're washing your hands for. So those are the ways that you can protect yourself. But typically all these viruses are more associated when it's cold. Because we stay in together, we have the central heating on, we shut the windows and we're all locked in together, and we only need one person to be infected. At the beginning of this outbreak, we essentially what the government called lockdown and shut everything down, so people weren't mixing. There was a lot of online shopping, but as we've gone back to mixing, we've gone back to getting closer to people, deliberately or inadvertently, whether we're playing sport or on the train or wherever, and we've just increased our risk of catching it.
Okay. What's the incubation period?
So the incubation period just essentially means how long from contacting somebody will you develop an infection, and so the evidence is that's 14 days at its maximum. The commonest is after 5 days. So if you had coronavirus and we weren't 2 meters apart and I caught off you, typically I would have developed symptoms within 5 days, but there is a possibility that I might not develop symptoms until day 14, which is why we have this isolation period of 14 days after a contact.
Okay, and that's to everybody, it doesn't matter what your ages are, that's what we're saying.
Yeah, so what's interesting is when we look at the evidence, it doesn't seem that one person or age group is more commonly at risk of catching it. It's what we call the consequences of catching it. So a young child or my children aren't at more risk of catching it, but the consequences of them getting it is less for them than it is for me,
Right.
because I am older.
So, in effect, even if they get, we're all back at school, we're all back at work, etc. So if you get it, it's not so much that you're protecting yourself, it's protecting everybody you're going home to as well. Hence the isolation.
Correct, and specifically protecting those who are vulnerable. So vulnerable, we mean that their immune system isn't working quite as well. So that could be a young person that's had a transplant, it could be a young person who's got severe asthma who's on taking steroids orally to dampen their immune system down. But typically we're trying to protect the older age group. So we know one of the what we call independent risk factors, one of the main risk factors is being over 65 years of age. So that's particularly the group we're trying to protect, because we know if they catch coronavirus, the consequences for them are severe. They're not at more risk of catching it, they're not more likely to catch it, but if they catch it, the consequences of them. So that's our grandparents, etc., great-grandparents, our patients or residents in nursing homes, care homes, etc.
So it's important for everybody to play their part.
It is. Yeah, so
precautions.
indeed, which is social distancing, washing your hands, wearing a face mask if you can, and doing good cough etiquette. So coughing into your elbow, disposing of your tissues, and not going to school or work if you've got a high fever, a new persistent cough, or you've lost your sense of taste and smell,
And arranging a test.
And arranging a test.
You were talking about hand washing. Is there any difference between using the hand gels that you see everywhere and hand washing with soap and water?
So what's interesting about this virus, it's called an RNA virus. It's not very strong. So actually alcohol gel will get rid of it the same as washing it off. All you're doing with soap and water is washing it away. Alcohol gel will kill the virus, but it won't be able to kill the virus if your hands are dirty. Hence why the message is to wash your hands, because that's the most effective for all scenarios. But if your hands are clean, alcohol gel will get rid of it just as easily.
Excellent. So we've got ways that we can actually protect ourselves and people around us. It's just keeping going with those protections that we've been following really for months now.
Yeah, and the question is what's going to happen going forward. It is likely that this virus will be like other viruses. So one thing to understand is we already have this type of virus, this coronavirus already exists in the UK. It causes a common cold. So it's likely that this virus will become like that, and that it will just be there all the time and will peak in winter. We would hope that a vaccine may be able to eradicate it, but that's potentially a big hope. So yeah, we're going to have to carry on doing all of this and learn to live with the virus and learn to live with the consequences, which is social distancing, hand washing, potentially face masks for several months to years going forward.
If we're going to live with this for months to come, as it stands now even, how can we best protect not just ourselves but people around us, over and above everything else that we've got here with the face masks and the social distancing? What can we do to make sure we're in the best position to fight this off individually?
Yes, that's really interesting, and there's obviously lots of research going on as to how could we protect people from catching infection in the currently. All we can say is that for any infection, if you're eating a healthy diet, if you're not smoking, if you're getting plenty of exercise, you're getting plenty of sleep, they will protect you and they will get your body in the best shape to fight off any infection should that happen to you. So, you know, getting plenty of sunshine for things like vitamin D, eating fresh fruit and vegetables for vitamin C, not smoking, losing weight if you're overweight. We recognise that they're universally better for you and will help you fight off infection if you're unlucky enough to get the infection.
Okay, so looking after yourself to look after everybody else as well.
Indeed.
Brilliant. Thank you very much for your time. Thank you for talking with us. I hope that you've all found this interesting. If you do have any further questions, talk to your teachers, and if they don't know the answer, they are more than welcome to contact our teams for any advice and information. That's not a problem. Your teachers will have a lot of background information on all of this, but obviously things are changing, things are moving forward, and there's always questions. You're welcome to ask them. Thank you. Bye-bye now.
Thank you.
Okay. So we've moved to the microbiology lab at North Tyneside Hospital. This is where we receive all the COVID specimens, but as you can see, we're busy doing all sorts of specimens, not just COVID. Ben is currently sorting through the samples, looking for the COVID swabs and selecting them out from the other swabs. And what we're going to show you today is the journey of a swab from specimen reception all the way through to the end result. So what Ben is doing here, he's been working in the lab for a few years now, he's sorting through the specimens that have come from all over Northumberland and North Tyneside that come to our laboratory, both at the hospital and from the GP. So the ones he's picking out now, they're all the COVID swabs. So somebody would have requested a swab, done a nose and throat swab on the patient and sent them through. But we get all sorts of specimens. We get urine, we get feces, we get blood, we get a fluid from around the brain, CSF, process. So we come down to a different part of the lab now, and Ben has passed the samples on to Annie, who is opening the samples in a special cabinet. This cabinet protects Annie from any spillage of the swab, so it sucks the air in, but it also protects the specimens as well. So this is called a Class 1 safety cabinet, and that's why we can work on it, these samples safely, because occasionally people haven't put the tops on correctly and the liquid spills out. Received an urgent specimen which we'll do singly, so obviously the clinicians want to know, the doctors and nurses looking after the patient want to know straight away whether the patient is positive for COVID. So again, Annie's wearing all safety equipment and is being handled in the cabinet to make sure that if there's any spillage, she won't get infected. So the next step is, after we've opened them, is to check the name on the form is exactly the same as the name on the sample. It's quite common, unfortunately, to get samples from different people, samples that are unlabelled, and we can't process them in the laboratory. We then date stamp the form, and then it'll show us the lab number that we give all the specimens. And he's put the same sticker on top of the specimen. That's how we know that specimen is from that patient, is from that form. So we've moved into another part of the laboratory now, and this is where we do all of our what we call PCR, polymerase chain reaction testing. So again, Ben has taken our urgent sample, he's taken one of the kit boxes that looks for COVID, and he's working in a safety cabinet that's sucking the air in so that he can't be infected from the sample itself. What's interesting is we actually test the liquid rather than the swab. So the swab releases in this case, RNA into the fluid, so RNA, which is like the instructions for how to reproduce the virus, into the swab, and Ben will pipette it up and put it into the cartridge. So Ben's now going to transfer that cartridge into the machine, and that will take about half an hour to an hour to give us a result of whether it's positive or negative. So you'll load the details in.
So we'll see from its previous test that it's positive for SARS and COVID. We've got 3 points the test looks for. So it's got your control, which is this line here, and you've got your 2 targets it also looks for COVID, which are these 2 corresponding lines here. That's how we can tell it's positive from this graph.
So this is the cartridge we use. when Ben talks about control, what is very clever about this technology is not only does it look for the virus, it looks to see if you've actually taken some human cells to make sure we don't get a negative result incorrectly because somebody hasn't sampled it. Inside the cartridge is essentially 4 labs where we take the sample in one well, it's then mixed and amplified, or the RNA is replicated, it's then extracted, and then the test occurs. And as Ben says, we look for 2 RNA targets. So this is a very clever test, but quite expensive. So because that sample was positive, we would then take measures to make sure that, first of all, the result is communicated to the person who it is. That's either through the GP, or we might ring them if it's a member of staff and explain to them that their sample is positive and what they need to do. We will also notify the government, and therefore test and trace can start, so they will be contacted, and all their close contacts would then be contacted about self-isolating, and that's how we process a swab.